So I'm going to go over what to expect for skin cancer removal surgery. I just had my skin cancer removed 2 days ago. Technically 3 days, but I'm on day 2 of the healing process, if that makes any sense. So one of my areas was able to be removed with a simple punch excision, which is just a little punch tool, and it's kind of like a hole punch for your skin. The second area, however, was more advanced and had to be removed with a scalpel because they needed to take more of a larger area of skin. So depending on how severe your skin cancer is, it will depend on how deep they go, but mine was about half of an inch. I had 8 stitches for my largest incision, and I had 3 stitches for my smallest. I'm going to walk you through from beginning to end of the surgery, so that way you know what to expect if this is maybe something that you are about to go through. I was pretty scared. I was pretty nervous. I won't necessarily say scared, but I was definitely nervous. Trust me when I tell you that the numbing is the absolute worst part of the actual procedure process. So you'll start by going in. They're going, depending on where on your body it is, they're going to have you undress and put one of those like paper doctor's office patient paper gown things on you. And then they're going to have you, they're going to talk to you a little bit about the procedure and make sure that you understand that this is a surgery and you're having a medical procedure done that day. After the medical assistant talks to you, she's going to leave the room and you're going to wait for the doctor to come in, and you're going to have a seat on the in the chair that they're going to be doing the procedure in. Once the doctor comes in, she's going to mark the areas where she wants to take from, and then she's going to have you just lay there and relax. She'll start by numbing the area first, and like I said, the numbing is the absolute worst part of the entire thing. It stings. I mean, it burns. It burns. Okay, guys, prepare yourselves for that. But it doesn't last too long, only a few seconds, the burning sensation. And they had to poke me quite a few times because of the amount of area that they had to take. I needed a bit of numbing. I will, right after this clip here, I will go ahead and show you the 2 areas that they took. So as you could see, we had one very small little circle, wasn't anything crazy, and then we had a much larger area of skin that had to be removed. That was the more advanced area. Most likely, your doctor will talk to you throughout the procedure to let you know exactly what they're doing. However, at the beginning of your procedure, I would suggest letting the doctor know if you want to know, like if you want them to talk to you through what they're doing. For me, it really helped to know what she was doing back there because there's going to be, and I'll talk about it in a minute, but there's going to be some sounds that you're going to hear, some smells you're going to smell. So the doctor most likely will start with the easiest one first. At least that's what she did with me. She started with the punch excision first. That was the smallest one. And that was pretty quick. And then she sutured me up. Not going to lie, you will feel them on your skin back there. You're not going to feel any pain, but it's cringy. Prepare yourself for that because you are going to feel them tugging and pulling. So when they are sewing you up, stitching you up, you're going to feel the tug and the pull of them doing that. So it's a little weird. And she had to use a scalpel for the second one for me. And I could feel her hand, run across my skin as she was cutting. So that was like, ugh, kind of gross. Now for a small punch excision, you won't have to do this next part that I'm going to talk about, but if you are having a larger area removed, like I was, someone wants to say hi. Hey. They will have to cauterize the spot. So when they cauterize an area, that just basically means that they are burning the tissue that is actively bleeding just to try to control some of that for you. That was the scariest part besides the numbing. That was the scariest part for me was when they cauterized it because it makes like this zapping kind of sound, and you don't feel any of it, but it makes like a zapping kind of sound, and you can smell your skin burning. Now, once they're done stitching you up and quarterizing and doing all of that, they're going to go ahead and bandage you up. Now, I had to have pressure bandages put on because of how large the incision site was. It's all the pressure bandage does is it just keeps you from bleeding too much. And you have to leave that on for 24 hours. So after 24 hours, you can then take that off and your bleeding should be fine, should be controlled. Then they're going to go ahead and give you your instructions and on how you should care for your incision sites, and then you're going to check out at the front desk, and that'll be that. You're able to drive because you are awake for the procedure. You're not put asleep. However, if you don't feel comfortable driving, I would suggest bringing someone there with you. I brought my husband mainly for support. He just wanted to be there to support me, but he did drive because it's on my back. It's difficult for me to really turn and move quickly and things like that. It's on my back in between my shoulder blades. My doctor also said no ibuprofen because it can thin your blood, so she recommended Tylenol. So I've been taking extra strength Tylenol over the counter, and yeah. The areas that they took will be sent off to pathology, and that is just to make sure that your doctor was able to get clean margins. So they're making sure that all of the cancer is gone. Hopefully it is, and if it is, then you just go for your regular checkups every 6 months instead of 1 year, especially if it's genetic, like runs in your family or you're just highly prone to it. If it comes back that your doctor wasn't able to get clean margins, then you'll go back in and you'll get more taken out, and then you'll handle it day by day. Let me know if you guys have any more questions about the procedure itself, if there's anything that maybe I didn't touch on. But that's all that I have to say about the procedure. As far as recovery goes, I'm on day 2, and I have been making videos, and I have posted them mainly on my TikTok, but I'm posting more update videos on my TikTok, but I have posted my cleaning and redressing videos on this channel as well. So you can check those out if you're curious about recovery. Very sore, but doing okay. Have a great day, guys, and good luck if you are about to have skin cancer removal surgery.